Hello everyone. So normal heart sound S1, S2. S1 is because of closure of atrioventricular valve. It is lup sound, low pitch sound, prolonged sound. While the S2 because of closure of semilunar valve. It is dub sound, high pitch, short. Two components are there. Physiological splitting occur between A2 and P2 component and also varies with the inspiration and expiration. Abnormal S1 heart sound according to intensity, loud S1 because of sinus tachycardia or if the newborn is having high output state. Muffled S1 can be because of pericardial effusion. This is the sound of loud S1.